Hi there, I'm Shawna Robins, and I am CEO and founder of Third Spark. And today I am doing an Authority Magazine interview with Dr. Bruce Dorr. Dr. Bruce Dorr is a senior medical advisor for Biote and an OBGYN with a subspecialty in urogynecology and reconstructive pelvic surgery. For the last decade, Dr. Dorr has directed his practice at a functional medicine practice of hormone health and wellness. Thanks for joining me, Dr. Bruce Dorr. Appreciate it.
It is such a pleasure. So I take it as such an honor to have such a celebrity interviewing me.
Yeah, well, I don't know about that and the celebrity, but certainly I'm very interested in all things menopause and all things women's health. So I want to know your background and how you became involved in menopause support for women.
Well, it really took me by surprise. I was a general OBGYN and I drifted towards and did the main center for the University of Colorado urogynecology studies at their Denver Health facility. And so it was interesting because I was a great surgeon. I was great at prescribing drugs and traditional menopausal therapy, but it wasn't enough for some of my patients. And I had a 38-year-old patient that unfortunately I had to remove her uterus and ovaries early because of severe pain and endometriosis. And she did okay, but went to not a great space and started using her husband's testosterone. And I brought her in and I said, well, that's kind of different for me. I don't know much about testosterone in women. And I said, let's just draw a level. And it was like to male ranges. It was like in the 700s. And she says, Dr. Dorr, I feel fantastic. This is the way I used to feel. In fact, I probably feel even better than I used to. And I said, well, why don't you stop it for a minute? That's a pretty high level for a woman. And it was still high after a couple of weeks. So I referred her to a specialist who said, why would you do such a dangerous thing taking testosterone as a woman? And she says, I feel great. This is the best I've felt. And I did not do well, unfortunately, when I lost my own body's natural hormones. And he said, I don't understand at 38, how much longer do you think you're going to be having sex? And so my patient was like, okay, I'm done with you, And so this notion that hormones are bad, and certainly that started with the Women's Health Initiative, the studies on Premarin and Provera. Hormones are not bad. Hormones are an essential part of us. And certainly when women go off that cliff of menopause and lose their estrogen, or when they lose their testosterone at much younger ages, it affects our quality of life. It affects our relationships. It affects our body, our brains, our bones, our hearts. And so it's very important that these be offered. It's not for everybody, but these be offered depending on how that patient is struggling with the loss of those hormones as we age or as we go through surgeries.
All right, what are your thoughts on, like you touched on the Women's Health Initiative, I really feel like personally that set women back, 20, 30 years with the misfindings of the facts on that regarding estrogen and breast cancer. So when you see women now in your clinic, give me an idea of some of the things that you're looking at. Are you looking at lifestyle things? Are you looking at just hormones? Are you looking at, do you take blood work beforehand or do you do it just based on symptoms? Give me an idea of what it would be like if I were to show up as a patient in your clinic.
Yes. So we have a lot of patients that are seeking us because of friends and referrals, but we require, it's a base kind of hormone testing. We look at estrogen, testosterone, thyroid. We look at many other things. It tends to be a much more informed interview. And many of the patients have never had a provider sit down and kind of go lab by lab as far as what's going on. When you look at hormone loss and response to hormones, it's about many different things. So we all have different receptors all throughout our body. When we look at hormones, these are messengers. Whether or not the message is going to our brains, our bones, our thyroids, whatever, it's got to click into receptors, and everybody's different as far as the amount of receptors and where they are in that whole process. So you've got to figure out where in that range of hormones that need replacing is that patient going to do best. Too little, not a good thing. Too much, not a good thing either. So it's important to see where these levels are, and it gives me guidance. It's also important to understand and come to where a patient is. You know, there are injections, there are creams, there are patches, there are what I do a lot of, pelleted hormone replacement therapy. These are all delivery systems of what I recommend is putting back into the body the same thing that's meant to be there, not derivatives from horse urine, not synthetic or modified versions that the pharmaceutical industry wants to push on patients for profit recommendations. So it's meeting that patient at what they can incorporate for the rest of their lives to feel good. In general, we weren't meant to outlive our hormones. We were meant to die in pandemics, or we were meant to die in childbirth or whatever. And so it's important that this is a relatively new phenomenon that we're living now much past our hormones. And so the beauty of hormones, and also looking at the whole body as far as how receptive a patient is to those hormones. That's diet, stress, exercise, those kind of factors that go on that allow receptivity to what I'm giving. It needs to, that's a relatively new thing. And so we want people's health line to match their age line. My mom lived to almost 101. And
Mm.
so it scares me to death. I'm going to live that long. But when I'm 101, I want to know and enjoy my children, maybe grandchildren at some point. I want to be able to walk. I want to be able to do all the things. And it's that healthy aging that hormones can help with. And then also counseling people on, hey, diet, lifestyle, stress, relationships. These are all things that are also going to contribute to healthy aging for you, not just hormones alone.
All right, I love that. I do agree with you that it's a full picture.
Yeah.
I've been using bioidentical hormones now for the last 2 years, and it's just been a game changer for me. But I have to tell you, it took me 5 different doctor's visits with 5 different types of doctors to actually find somebody who would give me a prescription. So what are
Right.
your thoughts on the current medical model for women? It's really challenging for a lot of us to get the care that we really need during this time.
Right. Unfortunately, the 2002 WHI, the Women's Health Initiative, not only scared patients about the use of hormones, but it scared providers. And so, if you don't stay current with the medical literature on the safety of what can be prescribed for your patients, then you will still have that mantra that hormones are bad. And there are people who out there, certainly in the medical profession, who are hormone haters. And you have a right to be a hormone hater when you only look at a certain subset of studies. And so being members, I'm a member of the Menopause Society, of the International Society for the Women's Sexual Health Study. So I think you need to keep current on the 20-year data of the WHI. When you look at the 20-year data of the WHI, there is a 22% decreased risk of breast cancer in the women who took horse urine alone, and a 44% decreased risk of breast cancer mortality. And so it's picking apart and looking at this long-term data rather than the knee jerk that happened in that study, to understand that and to get away from this notion that hormones are bad. When you look at the study of putting back into the body same stuff that's meant to be there, and that's what I call bioidentical, there's no data, convincing data, to say that you're doing anything wrong. It's how much you're using, how you're putting it there, and what you're using. And you can do that very safely for your patients if you have the right education.
Yeah, that's amazing. I really hope that as these conversations continue and as new information comes to light, we can really pull down the barriers of entry for women, the costs associated with it, the time, the headache, just the burden that I went through, you know, just having to be, you know, dismissed by doctors and, you know, having these really difficult conversations where even my OBGYN that delivered my 3 children was like, I don't know why you're here. I don't have anything for you besides a birth control pill. You can have it, not have it, up to you. Nothing's really going to help you. And it was so frustrating for me. And I know that a lot of women really feel that way. So I'm so grateful that someone like you is in practice and women can connect with you. So where can they find you? Where are you located? And are you online? Are you on social media?
Yes, well, I'm kind of an old guy, so I am on LinkedIn. That will get you to my website, and it certainly gets to Biote.com. Now, that is a marketing and educational company for bioidentical replacement, and it's not just about pellets. It used to be, but now it's about many different options that we are educating and offering to women. The other thing I'd like to make a point of in your personal frustration that you found, and this is true for many of my patients that I see, is that not only did not only did that WHI scare people, it stopped all hormonal education. So your providers, and this is OBGYNs, that have been educated since 2002, I should better say, they have not been educated. And so all hormone education stopped with that WHI in OBGYN residencies to the point where less than 20% of any OBGYN residents have had any education in hormone replacement therapy or menopause. And that is only through elective courses that those OBGYNs tend to take. Many of them are so caught up in delivering babies and being an obstetrician that they're not very good as far as being a gynecologist to a menopausal patient. So that is my whole mantra of being able to educate not only my patients and new providers, but OBGYNs who should be the first line of person you have trust. They delivered their babies, for you, and you have that trust. And then to come up with, no answers from who should be an expert is a travesty in my view.
Yeah, well, thank you so much for all that you are doing for women and women in midlife and your clients and your patients. And I will definitely make sure that your LinkedIn bio link is in this article. And what's your website so people can find it?
It's still got OBGYN to it. It's you can go to biote.com. That's my parent organization. I'm not employed by them. I'm a consultant. And it is LittletonOBGYNassociates.com. So even though I'm not an obstetrician anymore, I am a much better gynecologist and hormone expert. I see 30% men now because that helps take care of another aspect for my women's, health and wellness also. But you can find me at both of those sites.
Fantastic. Thanks, Dr. Dorr. Thanks for joining me today.
Thank you. Appreciate it, Shawna.